Good afternoon, everyone. This is Christina from Health Current, and thank you for joining us for the Objective 1 Protect Patient Health Information Security Risk Analysis webinar. This presentation is provided through a shared commitment between Access, ADHS, Health Current, and Myers and Stouffer to increase participation in the Medicaid Promoting Interoperability PI program. A few logistic reminders. Today's webinar will be recorded and posted to the Health Current and Access websites. We encourage you to use the chat box for questions or comments throughout today's presentation. If you can, please include your name, practice organization, and please do not include any confidential information such as patient health information or PHI. Just a reminder that all lines are muted. And Connie, are you with us?
I am.
Wonderful. Connie.
Great. I have the honor today of introducing Priscilla Clark as Senior Accountant with Myers and Stouffer, a certified public accounting firm specializing in federal and state Medicare and Medicaid programs. Will be our presenter today. Priscilla, go ahead and start your presentation. Thank you.
Thank you so much, Connie. So today we will be discussing security risk analysis for the Promoting Interoperability program. Just some of the learning objectives that we will learn from today's presentation is the first one is learn the required elements of a security risk analysis, otherwise known as the SRA. The second learning objective is for EPs to learn when to complete their annual security risk analysis to qualify for the PI program. And the third learning objective is for EPs to learn what resources are available to help them complete the SRA. So let's start off with what is a security risk analysis. A SRA should be an accurate and thorough assessment of the potential risk and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information held by the organization. So why does a practice need to conduct an SRA? Well, prior to the implementation of the program, the provisions of the proposed rule were released for public comment. Commenters expressed concern over privacy and security risk imposed by the implementation and use of the certified EHR technology systems. CMS responded that they intended to mitigate the risk to the security and privacy of patient information by requiring eligible professionals, eligible hospitals, and critical access hospitals to conduct or review a SRA in accordance with the requirements under 45 CFR and implement security updates as necessary. CMS believes maintaining privacy and security is crucial for every EP, EH, or critical access hospital that uses a CERT. The inclusion of the Protect Patient Health Information Objectives, otherwise known as the SRA, was recommended by the HIT Policy Committee for these reasons. The requirement originated in the Health Insurance Portability and Accountability Act of 1996, which is the HIPAA security rule. Conducting a risk analysis is the first step in identifying and implementing safeguards that comply with and carry out the standards and implementation specifications in the security rule. Since the inception of the Medicaid Promoting Interoperability program, meaningful use providers have been required to conduct or review their risk analysis each program year to receive an incentive payment. The objective of the security risk analysis is to protect electronic protected health information, which we refer to as Electronic PHI, created or maintained by the CERT through the implementation of appropriate technical, administrative, and physical safeguards. The measure is to conduct or review a SRA in accordance with the requirements under 45 CFR, including addressing the security, which also should include the encryption of data created or maintained by the CERT in accordance with requirements under 45 CFR. To implement security updates as necessary and correct identified security deficiencies as part of the provider's risk management process. There is no exclusion from this measure. So all EPs must meet the requirements. So what are some suggested tips for the providers or practices as they're conducting those security risk analysis? The practice needs to review the existing security infrastructure in your practice against legal requirements and industry best practices. You want to identify potential threats to patient privacy and security and assess the impact on the confidentiality, integrity, and availability of your electronic PHI. You want to prioritize risks based on the severity of their impact on your patients and practice. And the last tip is to determine if you need to perform a full assessment or review of the prior full assessment, and we'll get into more details about that. So what are the required elements of a SRA? The required elements are listed below. A SRA should contain a layered approach and be completed within the appropriate period. Although there's no specified method that guarantees compliance, there are several elements a risk analysis must incorporate regardless of the method employed. It must contain an asset inventory, which is also referred to as scope of analysis and data collection in the Office of Civil Rights Guidance. It must contain physical, administrative, and technical safeguards to electronic PHI. It must identify threats and vulnerabilities. It must determine the likelihood of a threat occurrence. It must determine the potential impact of a threat occurrence. It must determine the level of risk, and then it must identify remediation or action plan. So the timing of the 2020 security risk analysis. The SRA must be completed on or after the end of the promoting interoperability reporting period, and no later than December 31st, and must show the date completed. As you can see, we're discussing Program Year 2020 for this SRA. You can see there's a few examples in the table. So it identifies the promoting interoperability reporting period, which is also referred to as the meaningful use reporting period. So the first example, it says that the reporting period is January 1st, 2020 to March 31st, 2020. So that last column, when does that EP need to complete the annual SRA? As you can see, they can date it anywhere in between, or complete it between March 31st and December 31st of 2020. So that SRA, for it to be sufficient, it can't be dated March 29th. It must be dated on the last day of the reporting period or after, but it still must be completed inside calendar year 2020 for the Program Year 2020 year. So the second example discusses an EP who had a meaningful use reporting period October 1st through December 29th. Well, that last column identifies that that SRA needs to be completed on December 29th or until the end of the year, December 31st. So you only have a 3-day period where that SRA needs to be completed. You can start it ahead of time, but you need to make sure you wrap that up and make sure that you're analyzing and reviewing that SRA in between that time frame. The third example is an EP who has a meaningful use reporting period of June 1st through August 29th. And that last column identifies that SRA can be completed between August 29th and December 31st. The last example is we go back to that meaningful use reporting period starting in October, but for this one it's October 3rd through December 31st, 2020. Well, the only sufficient date at that point is that the SRA was completed December 31st, 2020. So even though as these practices and they're analyzing and completing the security risk analysis, they can start it in October if they want, but they need to make sure that they review that SRA and date it, all that work that they did on December 31st, 2020 for this specific EP. And so keep in mind the SRA report must include that completion date. So periodic reviews to security risk analysis. How are the practice supposed to determine whether they need to do a full review or just a partial review? The risk analysis is an ongoing process after your full SRA is completed. Meaningful use requires an SRA each calendar year for each PI reporting period. Providers must determine if a full assessment or review of the prior full assessment is needed. So on the left-hand side, you can see that shows the assessment. So should you perform a full assessment or a review of the prior full assessment, which means if you create an SRA in 2019, do you have to go complete an entirely new one, or can you just review that 2019 one, make the changes that are necessary that applies to your practice and what changed between the 2 calendar years, and date it? So in this middle column, you can see the report results. So you need to make sure you discuss the vulnerabilities, the threats, the risks. You need to document the results of your assessment. And then you need to date when your assessment was completed, the month, the day, and the year. So make sure those are on that SRA document and clearly seen. Under monitor and review, so you need to discuss the security incidents any ownership changes, the key staff turnover, new technology, system upgrades, action plans, corrective actions, things that you can see where the practice can improve on to protect that electronic PHI. So for a full review, you need to perform that full assessment. So you need to identify all the technology, the new technology. You need to identify if there was a system upgrade. So for practices that are upgrading from the 2014 cert to the 2015 cert, you need to make sure you identify those things. Any events under review column, which is to the right, you need to identify those things, and we'll discuss them in a moment. Anytime as determined by the practice, you may need to conduct that full assessment. As you can see, for the perform review, you need to discuss security incidences, ownership change, key staff turnover, what the process is at the practice for those things. For prerequisites, so there is, for you to conduct just a review of your security risk analysis from last year, you do need to, it would require you to have completed a full assessment in a previous year. So just if you're not completing a full SRA and starting from beginning to end, and you have that partial one that you completed in 2019, for example, just make sure you use that document, update anything that's necessary that changed at the practice. The SRA report documentation. So for the full assessment, you need to, it can be a practice security risk report. It can be a vendor security risk report. There are SRA tool reports from NIST, which is the National Institute of Standards and Technology. We have seen a lot of practices use that tool for their practice. You want to make sure that if you hire a third party to come in and review your practice and to create that security risk analysis, that would be sufficient, but you need to make sure that you know what that third party is doing, because you're still responsible to make sure that the third party you hired is doing it correctly and meets the requirements of this program. So we do advise practices to make sure that their security risk analysis is completed and sufficient. When you do a review of a prior full assessment, you can have emails documenting the security team's review of the prior year's SRA. The email must demonstrate that no updates were necessary. So for example, if you completed an SRA in program year 2019 and you want to use that same SRA in program year 2020, and you reviewed it, but no updates were done because there wasn't any changes at the practice, well, you still need to make sure you date that or have some type of email or document showing, hey, at the end of program year 2020, we did analyze the 2019 SRA and we determined that there was no changes done at the practice, so nothing needed to be changed to that document. But you can't just say, oh, I'm going to keep the date from 2019 on there and submit that for my program year 2020. You need something to support your reasoning and why nothing changed. You can submit a signed and dated memo documenting the data review and the review procedures. So if you took that 2019 SRA and you made notes of what did change, make sure you date what you did, like put the date on there and identify what did change. Another example that can support a review of prior full assessment is meeting minutes showing the annual SRA review. So if the practice had a meeting with all their employees and they documented from their notes, the end of December, hey, we did review this SRA. That would potentially be sufficient, but just keep in mind that we need to know the exact date that y'all did review that prior full assessment. So another requirement of the SRA is the asset inventory. A SRA should identify where all electronic PHI is stored, received, maintained, or transmitted. The asset inventory is used to determine the scope of the security risk analysis. The asset inventory can be in multiple formats. As you can see, there's two different examples on this slide. The first example is a separate listing. So it shows that the practice identified that they had 15 laptops, 25 desktops, 5 smartphones, 55 employees, and they have Athena as their cert. So those types of things, it's identifying your SRA that you did review those items, and it just shows what the SRA is covering. So it's covering everything at the practice that could contain electronic PHI on it. Another example is that it can be in paragraph format within the SRA. So it identifies, this practice employs 25 medical providers and 2 office personnel. So it's up to the practice on how they want to document that they did an asset inventory, but they need to identify that in their SRA and explain what it covers. So moving on to safeguarding electronic PHI, according to the Centers for Medicare and Medicaid Services, the SRA should not review only the EHR system, which is the technical aspect. The SRA should contain physical, administrative, and technical safeguards to electronic PHI. So there are sometimes where a practice thinks that, okay, well, we have Athena as our cert, and they provided us an SRA, identifying how Athena works and how it's protected. Well, that would not be sufficient. The practice needs to conduct their SRA and identify physical and administrative attributes at their practice and even the technical attributes at their practice that are protecting electronic PHI. A new requirement as of stage 2 in 2014, the SRA is required to address the security and encryption of their electronic PHI in accordance with 45 CFR. So we're going to go through some examples of what falls underneath physical, administrative, and technical safeguards. When it comes to that encryption, just make sure that your SRA is identifying whether you have encryption at the practice or not and what that encryption entails. So going over some examples. So for physical safeguards, some examples are building alarm systems, locked offices, screens shielded from secondary viewers. You want to identify in your SRA what physical safeguards that practice has implemented, such as if you have an alarm system or you have locks on the doors, you have locks into any rooms that store paper copies of patient health information. For administrative safeguards, the SRA needs to identify things such as staff training, monthly review of user activities, policy enforcement. If an employee leaves the practice, what administrative safeguards are in place to ensure that all their access to PHI is taken away from them? So do you have policies in place for that? So identify those policies that are in place to protect that. Especially when it comes to staff training, what are you training them on? What policies do you have in place? Like, just identify those policies and maybe get a brief summary of what each policy entails to just show that your practice is doing what it needs to do to protect electronic PHI. The other example is first technical safeguards. So if your practice has passwords for the computers and each employee has their individual password, identify that in the SRA. Do you back up data? So state, okay, we back up all this PHI. Is it securely backed up onto a server? Do you run virus checks, or does your system, your computer system, run those virus checks? And again, you need to identify the encryption at the practice. Is your PHI encrypted? You need to make sure, even if it's not encrypted, you need to state that, because you must address encryption. If your SRA does not discuss encryption of that electronic PHI at the practice, then that SRA would not meet the requirements for program year 2020 or anytime after 2014, which is when CMS implemented that. So let's talk about current security measures. So organizations should assess and document the security measures an entity uses to safeguard electronic PHI. Whether security measures required by the security rule are already in place, and if current security measures are configured and used properly. So we just discussed what physical, administrative, and technical safeguards are. So now we're going to look at those, like what's in place currently. So a sample of a threat for physical is that if there's a natural disaster, tornado. So when you're walking through trying to identify current security measures, you want to say, like, okay, what security measures are in place in the event of a natural disaster? And if you look to that far right, you can state that data is backed up to an offsite server daily in the event of a natural disaster that destroys the main server room. That's just one example of how you're going to identify those physical safeguards that are currently in place at the practice. So as you're looking at administrative, which is that second example, so what if a disgruntled former employee poses a threat to electronic PHI? So you fired someone at your practice, they could potentially use that patient health information. So you want to ask, is there a protocol in place to report a breach of electronic PHI? So then you want to state, so on the right-hand side, here we have an example of a practice for breaches of electronic PHI. They will be reported in accordance with the practice security management policy. So that is an administrative safeguard, saying that the practice has something in place in case that potentially would happen. Then for technical, the last example, we're talking about a security breach to the cert. So you want to ask, is there something in place to prevent a breach of that cert system, the breach of electronic PHI? So an example would be that firewalls are in place to protect against breaches of security. So the practice has implemented certain things on their system to stop that from happening. Now, could it still happen? Potentially, but you want to identify what is the practice doing to keep that electronic PHI safe. Then we move into like threats and vulnerabilities, which you also need to document in your SRA. So organizations must identify and document reasonably anticipated threats to electronic PHI. They need to identify the threats that are unique to the circumstances of their environment. And they need to identify and document vulnerabilities, which, if triggered or exploited by a threat, would create a risk of inappropriate access to or disclosure of electronic PHI. Keep in mind, all these examples we're discussing, that it could be very different for your practice depending on the size of your practice. So you need to think about what would impact your specific practice and what is potentially a threat at your practice if you don't have a certain safeguard in place. So some examples of threats and vulnerabilities include but are not limited to the following. So for a natural disaster, the tornado does damage to the server room. The other example that we discussed previously was a security breach to the CERT, or theft of a laptop containing electronic PHI. So when you fire that employee, could they potentially take a laptop? That potentially could be a threat if they're not, all their access isn't taken away immediately. The third example is the disgruntled former employee, which leaks patient files. So these things could potentially occur. You're not stating that they're going to occur or that they have occurred in the past. You're just identifying certain things that could occur. The threats and vulnerabilities identified may vary significantly based on the size, type, and complexity of the practice. So keep that in mind. So then you have to identify the likelihood of the risk. So you identify those threats and vulnerabilities, and so now you're looking, hey, how likely is this going to happen? The security rule requires organizations to take into account the probability of potential risk to electronic PHI. The results of this assessment, combined with the initial list of threats, will influence the determination of which threats the rule requires protection against because they're reasonably anticipated. Practices could assign a likelihood to each of the identified threats or vulnerabilities. For this example, we're going to use a number scale from 1 through 5, and 5 being very likely and 1 being not likely to happen. So for a natural disaster, a tornado does damage the server room. That potentially could occur, but it's very, depending on where your practice is located, it could be very unlikely. And so in that example, if it's very unlikely to happen, you would want to put it as a 1 on the likelihood score. Whereas security breach to the CERT, so it's a possibility that someone could steal a laptop containing PHI. So you're like, oh, that's like medium. Like, I don't think it's going to happen, but it could potentially, like, it's higher up there of likely to happen. You want to put a 3 there. Other examples for the likelihood score, you don't have to identify it 1 through 5 or 1 through 10. You could do low, medium, or high risk for it likely to happen. So depending on what the practice is using, what you think is best that applies to your practice. The third example is that disgruntled employee leaking patient files. For this example, we put it as a 3. So if that could potentially happen, you want to identify that maybe it might be, it's more like a medium risk potentially, depending on what protocols your practice has in place. So if you, for example, whenever you fire an employee, you have a security person there that immediately is beside that employee and escorts them out of the building, that might be a lower likelihood score then. It just depends on what you have implemented at your practice. Moving on to impact of risk, this is also going to use a score. The rule requires consideration of the criticality or impact of potential risk to the confidentiality, integrity, and availability of electronic PHI. An organization must assess the magnitude of the potential impact resulting from a threat triggering or exploiting a specific vulnerability. An entity may use either a qualitative or quantitative method or a combination of the two methods to measure the impact on the organization. As you can see, there's a lot of things that could change depending on the practice, but the practice still must identify, regardless of the size, so you need to identify the impact of that risk. And so just like for the likelihood, we're going to use that number scale 1 through 5, 5 being critical. So for that natural disaster, if a tornado does damage the server room, it's probably going to take it out completely. So that impact score is going to be really high impact, so we're going to put it at 5 because it's extremely critical. That security breach to the CERT, the threat of a theft of a laptop containing electronic PHI, that may be medium. So they may steal the laptop, they may potentially, in the third example, leak it. If they do leak it, then it's definitely, that patient health information is out in the public. So that impact score would be a 4. So depending on how you think it's going to impact your practice, that's what you're going to put on there and document in your SRA. So level of risk. This overall level of risk is going to take that likelihood score and that impact score and kind of combine it. So organizations should assign risk levels for all threats and vulnerability combinations identified during the risk analysis. The level of risk could be determined, for example, by analyzing the values assigned to the likelihood of threat occurrence and resulting impact of threat occurrence. For this example, the risk level determination might be performed by calculating the average of the assigned likelihood and impact levels. So we're using the same 3 examples from the previous slides. As you can see with the tornado, in that first example, it shows a likelihood score of 1. The impact would be a 5. So that risk level, that overall risk level, you're averaging the likelihood and the impact, that would be a 3. Then that second example, that security breach to the cert, would be the likelihood was we put as 3, the impact we put as 3. So that overall risk level is going to be 3. For the disgruntled employee, shows the employee leaking patient files, so the likelihood is medium. The impact is a little bit higher, so it's a 4. So that overall risk level is going to be that 4 because you want to make sure you're identifying what potentially could happen at your practice, because you'll see when we get to the action plans, the remediation plans later on, it's going to use those risk levels to determine where the practice needs to focus on implementing additional security protocols potentially. And again, you can use low, medium, or high for these to determine what that overall risk level is as well. So that action plan. The SRA should include a list of corrective actions to be performed to mitigate each risk level. So all deficiencies do not have to be mitigated prior to attestation. The PI incentive program requires correcting any deficiencies according to the timeline established in the provider's risk management process. So as you can see, we're taking those risk levels. So if you look in the 5th column, it's the header name is risk level, and you can see those risks. So it's 3, 3, and 4. So whenever you're doing an SRA, if you have a high risk level, if you have anything above a low risk level, you need to create that action plan. Say, hey, what's the practice going to do to try to lower that risk? As you can see for the first example, the natural disaster, it's at a 3. So that action plan is going to be implement disaster recovery plan. So how are you going to recover fix all that damage that happened? So then you're going to put an estimated completion date. That estimated completion date does not have to be in 2020. It can be in 2021. It can be in 2022. You can say you're going to implement it at some time in the future. It doesn't have to have an exact date for that estimated completion date. And this date is separate from when the SRA is completed, so keep that in mind. The second example is security breaches to EHR. So that risk level is 3. So an action plan would be to encrypt all laptops. And so you can say the action is already in place. You already have encryption for all laptops. So if you do identify something that's high, but there's nothing really the practice can do more, or it'd be kind of ridiculous for a practice to do something additional because they're such a small practice, then you can leave it as, you know, we have the protocols in place currently that are necessary to limit this. But nothing else will be done further. That's fine, but you just need to identify that, because anything that has a risk level above low, which would be a 1, potentially a 2, you need to document and explain why you're not doing something to lower that risk level, because the purpose of the action plan is to lower that overall risk so that the practice has as little risk as possible where patient health information can be leaked or given out to the public. The third example is that disgruntled employee. So that risk level is 4. So that's a medium or high risk at this point. So you want the practice in this example decide to revoke access to systems for terminated employees. That action is ongoing because as an employee is fired, they're going to go and do that. So you're explaining that, you know, this is a 4 because it could happen, but the practice is doing everything that they potentially can to stop that access to the systems for terminated employees. So for the final risk report, the security rule requires a risk analysis to be documented, but does not require a specific format. Regardless of the format chosen, the previously discussed elements should be well documented in the final report, regardless of the type of assessment performed. So it needs to identify the look-back period this SRA covers. So did it cover all of calendar year 2020? Did it cover a portion of it? You want to identify and be as clear as possible. And you want to make sure that completion date review has a specific date. So month, day, and year, because we're looking for that day to make sure that it was on or after when the MU reporting period ended. So just make sure you're documenting those things and you're documenting all the requirements of the SRA. Okay. So let's discuss some audit findings of what is most likely that we discovered during our SRA audits, and then what happens during an audit. So all providers that receive a Medicaid PI incentive payment could potentially be selected by Access for post-payment audit. If selected, Access post-payment analysts will conduct a thorough review of the documentation attached to the EP's attestation and EPIP to determine if it meets the program requirements. Access may have follow-up questions or make additional documentation requests depending on how your SRA is documented. Failure to complete, just some common audit findings that we see a lot, is failure to complete and or update the SRA within the appropriate time period for the program year. This is probably the most common because providers may just put, oh, 2020 on it. You know, we completed it in 2020, but we need to see that exact date. So you want to make sure you date the SRA for when you completed it. Another common finding is failure to maintain documentation. They may not, if a third party did it, they may not have saved it where you can easily find it, or you may have lost that document. So you need to make sure you keep your documentation and that it is sufficient and meets all the requirements. Another common finding is failure to sufficiently document all required elements of the SRA. So for example, if you did not discuss, you did not identify any risk, like you didn't identify the overall risk, the likelihood, or the impact, then that one requirement not being met causes the SRA to not be sufficient. So you make sure every single required element is identified in that SRA. So here are some resources and things that we pulled from. So if you have questions or want to see where we pulled it from, these are all links that will take you to different websites. The first one is the Objective 1 tip sheet from CMS. It's on CMS website. You can click on that link, it takes you straight to there. There's also the HIPAA security rule, which is where we pulled a lot of the requirements from and the guidance. The guidance from Office of Civil Rights. Throughout this presentation, you probably saw at the end of each slide, it identified where we pulled the requirements from. So if you are curious and want more details about it, or to see where we pulled each of these requirements from, you can go and click on those links. CMS also created an SRA tip sheet that you can look at. We have also, on the 5th bullet point, you can see the National Institute of Standards and Technology, SRA instructions and template. So that's just a potential template that the practice can complete. There's a couple templates that we've identified on this page that SRAs, that practices can use. Just keep in mind as you're using these templates, make sure it addresses all the requirements of the program. Because if you use a template, maybe it's not one that we recommend on here, but if you use any template, it's still up to the practice to make sure that the SRA covers all the requirements. The practice can't, if they fail to address encryption and they don't discuss encryption at all, the practice can't use, oh, well, we used this template and the template didn't ask us about encryption at our practice. Well, that's on the practice, so, or the provider. So make sure whatever SRA is being used, that it meets every single requirement. So you may need to add in an extra sheet, an extra Word document to explain maybe the required elements that weren't in that template. So you just need to make sure your template is, when you're using that template, that it addresses all those requirements, and if it doesn't, you need to add that in. We've also linked the federal final rule here. There's also the two bottom links, the security risk analysis, frequently asked questions, and the tips for creating a security risk analysis. I'm going to pull up in a few minutes, and we can go through those, and it kind of just condenses all of this information to what requirements are there. Okay. So what we will do, though, is if you have any questions, Christine will read them out to me, and I can answer those questions you have about analysis, and then I'll show you all those tip sheets.
Okay, thank you so much, Priscilla. Just a reminder, folks, that the chat box is open, and if you've had questions throughout today's webinar, and you haven't had a chance to type those in, now is a great time to do that. Currently, I do not see any questions in the chat box, Priscilla, so we'll give folks a few minutes to ask any questions they have.
Okay, perfect. Thank you so much, Christine. So I will go ahead and show y'all the tips for completing a security risk analysis. There's a few questions listed on here, just some questions you may have. It's a one-page tip sheet that just kind of condenses all that information. So it asks, what is a security risk analysis? The SRA relates to Objective 1, protect patient health information. The objective of the measures to ensure providers and practices are protecting electronic PHI, created or maintained by the CERT through the implementation of appropriate technical capabilities. Keep in mind that it's not, your SRA shouldn't just cover the CERT that is implemented at the practice. It should cover everything, the building and everything that potentially has patient health information in it, on it, whatever that is. Another question was, how do I conduct an SRA? So it should be conducted or reviewed in accordance with the requirements under 45 CFR. It should include addressing encryption of data created or maintained by the CERT. It should implement security updates as necessary and correct identified security deficiencies as part of the provider's risk management process. This third question discusses what components should the SRA include. And so that kind of just, those bullet points right there list out specifically what you need to make sure your SRA covers. Keep in mind that the SRA should be conducted, reviewed, or updated on or after the end of the PI reporting period and no later than the end of 2020 calendar year. If your SRA is dated January 1st, 2021, that would not meet the requirements because it shows that you finished it on January 1st, 2021. So you need to make sure you have it dated sufficiently for when it was completed and that you completed it when it was supposed to be. You need to make sure the SRA includes the physical, administrative, and technical safeguards, including encryption, tailored to the size and complexity of the practice. So that will change. So those examples we discussed throughout the presentation, those may not apply to your specific practice depending on its size and what security protocol you have in place currently at your practice. The SRA needs to identify the asset inventory that identifies where all electronic PHI is stored, received, maintained, or transmitted, not limited to the CERT. So if you have other things besides the CERT that you have at your practice where electronic PHI is stored, you need to identify those things. If you have tablets that have certain patient health information, you need to identify that. The SRA needs to also identify all potential threats and vulnerabilities to electronic PHI at the practice. The SRA needs to do an assessment of all current security measures at the practice, an assessment of the likelihood, the potential impact, and the overall risk. So as you're doing those three things and putting them on a scale, low, medium, high, or between 1 and 5, you need to make sure you're doing that for the likelihood of the threat happening, the potential impact of that threat if it occurred, and then the overall level of risk. You need to date when the analysis was conducted, reviewed, or updated by the practice, that month, day, and year. We need all three of those things. You can't just put, it was completed December 2020. It needs to have that day on there. You need to identify the action plan, which is for when you identified any medium or high risk for the likelihood, the impact, and the overall risk. So like anything is flagged as medium or high, you need to identify a future action plan or explain why you're not implementing a future action plan currently, because maybe you already have one in place. Something along those lines you need to explain, and I document it and write it down. So what are the best practices for the SRA? You want to ensure the completed SRA is retained for a minimum of 6 years from the date of attestation. You want to ensure the SRA is for the correct period. If it was reviewed and no updates were made, you want to retain documentation to show the date it was reviewed, because it still needs to be dated on or after the last day of the PI reporting period. If a third party completes the SRA, you want to ensure it is tailored specifically to your practice. You want to ensure the SRA encompasses all aspects of the practice, so anything that handles electronic PHI should be included in the scope of the SRA. You want to ensure that the SRA can be completed using several different, or the SRA can be completed using several different methods. So ensure that the format used includes all the components listed above. So if you're using a template, you want to make sure it covers all those requirements that we discussed that needs to be documented in an SRA. And if that template does not discuss that requirement, you need to add it in there because the practice and the provider are responsible for making sure all those requirements are met. So what are the most common mistakes related to the SRA? So if the practice does not complete an SRA or properly document that the SRA was completed, that's a common failure for not meeting the SRA requirement. If the practice does not retain the SRA for the correct time period, the SRA does not assess the risk level of the threats and vulnerabilities identified. That is a common threat because the practice doesn't know that they need to do that. You need to ensure that your SRA does incorporate that risk level. Another common failing is if the SRA does not include an action plan addressing how the identified threats and vulnerabilities will be mitigated. Anything that's medium high, you need to make sure there's an action plan or you explain why you're not implementing an action plan. The SRA does not include an asset inventory, then they do not meet the requirements of the program. If the SRA only was completed based on the capabilities of the CERT and does not incorporate assets outside of the CERT, which handle electronic PHI, that is also a failing point. And then the completion date of the SRA not indicated. So if the SRA just says December of 2020 and your meaningful use reporting period ended in December, we don't know if you did it on the last day or after for that PI reporting period. And then another common failing is if the SRA does not cover the PI reporting period, the SRA must cover that promoting interoperability reporting period. There's a few more links taking you to the Office of Civil Rights, the tip sheet, and other guidance from CMS that you can use as resources. Christina, are there any questions that have come in yet?
Priscilla, no, there have been no questions. But just a reminder to folks that the slide deck will be sent to all attendees, and the recording and the slide decks will be posted to the Access and Health Plan websites.
Perfect. Thank you so much, Christine. So we'll go for the last tip sheet that was created just to help give you more guidance because the security risk analysis is a common selling point for a lot of practices and providers because they don't know exactly what has to be documented in that SRA. Again, if you have questions, please put them in the chat box and Christine will read those off to me and I can answer those. If you can't think of any questions now and you have some later down the road, I'll show y'all the contact information for if you have any additional questions after this presentation so that y'all can get those questions answered because we want to help y'all as much as possible. So it kind of just explains, the first couple paragraphs explain the security risk analysis, how you're supposed to meet that requirement. It references the final rule, which is where these requirements are mentioned and that the practice or provider must meet the requirements of the security risk analysis to receive a payment. There are numerous methods of performing the risk analysis, and there's no single method or best practice that guarantees compliance. Although there is no specified method that guarantees compliance, there are several elements a risk analysis must incorporate regardless of the method employed. And it is up to that provider who is receiving that payment or the practice that's receiving the payment to make sure they meet those requirements and their SRA covers all of these requirements. So this is a very helpful tip sheet in that this table lists every single requirement that we're going to look for when analyzing a security risk analysis. So it would be a good practice for when that security risk analysis is being created and completed that you go through here and make sure you check off each of these requirements. So that time period. So what we first do when we see a security risk analysis is we look for the date, because if it's not dated sufficiently, then everything else listed is not going to matter because you didn't make sure it covered the correct period. So the SRA must be completed on or after the end of the PI reporting period. So the analysis covers the full reporting period and must be conducted within the 2020 calendar year. As you can see in this column, regulation references, it references where in the final rule we pulled these requirements from. So it's showing that CMS is requiring these practices to meet these requirements. The scope, so that's going to be that asset inventory list. The analysis should include all electronic PHI that an organization creates, receives, maintains, or transmits. And it also points out where that guidance is. The other requirements of the SRA is going to be that safeguard. And so that's going to be the physical, administrative, and technical safeguards. So organizations should assess and document the security measures an entity uses to safeguard electronic PHI. The security rule requires that you put into place reasonable and appropriate administrative, physical, and technical safeguards to protect your patient's electronic PHI. The security rule allows you to tailor security policies, procedures, and technologies for safeguarding electronic PHI based on your medical practice's size, complexity, and capabilities, as well as its technical, hardware, and software infrastructure. The next requirement is going to be the encryption requirement. So the practice must assess whether implementing a mechanism to encrypt and decrypt electronic PHI is a reasonable and appropriate safeguard in its environment. If reasonable, implement the mechanism. If not reasonable, document why it is not reasonable and implement an equivalent alternative measure. So regardless of whether you have encryption at your practice or not, you must identify that you don't or that you do have it and what it's encrypting. The other requirement is the threats and vulnerabilities. The organizations must identify and document reasonably anticipated threats to electronic PHI. Organizations may identify different threats that are unique to the circumstances of their environment. Organizations must also identify and document vulnerabilities, which, if triggered or exploited by a threat, would create a risk of inappropriate access or disclosure of electronic PHI. The practice must identify the level of risk. So organizations should assign risk levels for all threats and vulnerability combinations identified during the risk analysis based on the likelihood and impact of the threat occurrence. So you need to make sure you're identifying those risks, low, medium, high, or on a scale of 1 through 5 or something along those lines for each of those threats identified. The security rule requires a risk analysis to be documented but does not require a specific format. So it can be in Word, it can be in PDF, it can be any type of template. That's up to the practice to decide, as long as that document, that SRA, addresses all of these requirements discussed. The final requirement is an action plan. The SRA should include a list of corrective actions to be performed to mitigate each risk level, so that level of risk requirement. Any security updates and deficiencies that are identified in the review should be included in the provider's risk management process and implemented or corrected as dictated by that process. All deficiencies do not have to be mitigated prior to attestation. The PI incentive program requires correcting any deficiencies identified during the risk analysis according to the timeline established in the provider's risk management process, not the date the provider chooses to submit meaningful use attestation. The timeline needs to meet the requirements under 45 CFR, including the requirement to implement security measures sufficient to reduce risk and vulnerabilities to a reasonable and appropriate level to comply with the final rule, 45 CFR. So keep in mind that when you identify those level of risk, that you have something, an action plan that's going to help mitigate and lower that risk, or at least identify why you're not putting that action plan into place. So just make sure you're documenting everything, and even if you're thinking it as you're going through and creating that security risk analysis, make sure to put that down so when the auditor asks for that SRA, you have that ready to go, and it explains that whole process that you went through for the risk level and why something was assigned high or medium or low, or why there isn't an action plan. You want to make sure you document all of that. Okay. Christine, are there any questions anyone has asked?
Priscilla, this is a little note from Carolyn to review the SRA requirements for multiple EPs using different PI reporting. Is that
Christine,
yeah.
you're very garbled, very garbled.
Oh, okay. The question was, is it possible to review the SRA requirements for multiple EPs using different PI reporting periods?
Yes, and I can bring that. So I can definitely discuss that item. So one thing to keep in mind, when there is multiple SRAs that, or multiple EPs at the same practice, and there's different in PI reporting periods, only one SRA can be you don't have to complete an SRA after each MU reporting period. So for example, if there are 3 providers from one practice and one provider had an MU reporting period in the first 3 months of 2020, and then the other 2 EPs had a reporting period from October 1st through December 29th. The practice only has to complete one SRA, and that SRA, if there's only one SRA completed, it must be dated on December 29th or completed December 29th, December 30th, or December 31st. You don't have to complete an SRA right after the first reporting period and another SRA right after the last reporting period. However, the caveat is that that SRA needs to cover the entire calendar year, and you should document that the SRA covers all of 2020. So it covers that first PI reporting period in the first 3 months of 2020, and it covers the one that's at the end of the PI reporting period. Now, that's up for the practice to determine if they should be doing quarterly updates for SRA. That's for the practice to decide. However, when we request an SRA for all the providers at that practice, just make sure it's dated to be sufficient for the last, it covers all the ending reporting periods. Okay. Are there any other questions?
Not at this time, Priscilla.
Okay. One thing just to keep in mind, y'all, if you do have any questions or anything, please feel free to reach out to Access or Health Current after this presentation is over. We want to make sure that we help y'all complete those SRAs and make sure there's questions. Any questions about the dates or specific requirements, please feel free to reach out to Access or Health Current to ask those questions.
Wonderful. Thank you so much, Priscilla. We appreciate all of your insight and knowledge on the subject today. And again, if you have questions for Priscilla, there is a not only the resources tab, but I believe your email address is also included in your Priscilla, or a general mailbox for that. Again, thank you for all who have registered to participate in today's webinar. Again, you'll receive a copy of today's webinar slide deck, and this call has been recorded and will be posted along with any Q&A that we have throughout the day. This concludes today's webinar. Thank you, Access, for your presentation today. Thank you for all participating. Have a wonderful rest of your day. Stay safe out there. Thank you.